beta-1 blockers, amoeba cabin, we have to see bold capital letters. A. Atenolol, M. Metoprolol, E. Esmolol, B. Bisoprolol, A. Acebutolol, C. Hi friends, welcome to Pharma Classes Learn at a Glance. I am Dr. JP. Today we are going to discuss drugs used in hypertension using the book Pharmacology Learn at a Glance. We are going to see. Total this topic is being explained using this slide. Take a screenshot of this. In order to understand these antihypertensive drugs, we must know about the meanings of the following. First, cardiac output. It is nothing but the amount of blood pumped by the heart each minute. Cardiac output is the product of stroke volume and heart rate. Next, peripheral vascular resistance. The resistance offered by systemic circulation is known as systemic vascular resistance. It is used to calculate blood pressure, blood flow, and cardiac function. Next, reflex tachycardia. When blood pressure drops, the heart beats faster in an attempt to raise it. This is referred to as reflex tachycardia. Last one, pheochromocytoma. It is a non-cancerous tumor that develops in the adrenal gland. Next, coming to the hypertension. If the arterial blood pressure is more than 145 by 90 mm of Hg, is known as hypertension. It can cause serious health problems and increase the risk of heart disease, stroke, and even death. Blood pressure is the force exerted by blood against the walls of blood vessels. Arterial blood pressure is regulated by pressure-sensitive neurons called baroreceptors, which are located in the aortic arch and carotid sinuses. Blood pressure is the product of cardiac output and systemic vascular resistance. We must first study the basic physiology of blood pressure in order to better understand the pharmacology of antihypertensive drugs. Now let us discuss the basic physiology of blood pressure. First one, the role of alpha and beta receptors on blood pressure. If the blood pressure drops too low, the baroreceptors can send signals to adrenal medulla, causing catecholamine release and an increase in sympathetic activity via alpha and beta receptors. First, let us discuss alpha-1 receptors. Stimulation of alpha-1 receptors on smooth muscle induces vasoconstriction and consequently an increase in vascular resistance, which leads to a rise in blood pressure. Next, beta-1 receptors. Activation of beta-1 receptors causes an increase in heart rate, stroke volume, and increased cardiac output, which leads to increased blood pressure. Next, second one, role of renin-angiotensin aldosterone system. Renin is a peptide hormone secreted by the kidney. It facilitates the conversion of angiotensinogen to angiotensin 1. This is then converted to angiotensin 2 using the angiotensin converting enzyme. Angiotensin 2 is a potent vasoconstrictor. It also promotes the release of aldosterone, which leads to sodium and water retention, thereby increasing blood volume, cardiac output, and ultimately increased blood pressure. Here you see, renin converts the angiotensinogen to angiotensin 1. Angiotensin converting enzyme converts the angiotensin 1 to angiotensin 2. Binding of angiotensin 2 to angiotensin receptors leads to the increasing BP. Next, coming to the role of calcium on BP. First one, calcium channels on vascular smooth muscle. When calcium enters the smooth muscle cell, it causes to contract, resulting in increased vascular resistance and as a result an increase in blood pressure. Second one, role of calcium channels on heart muscle. They increase cardiac conduction and contractility. Next, coming to the role of alpha-2 receptors on blood pressure. Alpha-2 receptors are located on pre-junctional terminals of adrenergic neurons, where they act as a negative feedback mechanism to decrease noradrenergic release, resulting in a decrease in blood pressure. Next, coming to the role of Nn receptors on BP. Nn receptors are located on the autonomic ganglia. Depolarization of Nn receptors activates postganglionic sympathetic neurons, resulting in a rise in blood pressure due to sympathetic neurotransmission. Next, coming to the role of adrenergic neuron. Neurotransmitters like noradrenaline and dopamine are stored in the synaptic vesicles. When the adrenergic system is activated, noradrenaline attaches to the postsynaptic receptors on the effector organ, thus causing elevated blood pressure. So far what we have discussed, let us see. Blood pressure increases when the following 7 ion channels or receptors are activated. What are those? Alpha-1 receptors, beta-1 receptors, renin, angiotensin converting enzyme, calcium channels, NN type of nicotinic receptors on ganglia, adrenergic neuron activation. Activation of these ionic channels or receptors leads to increasing the BP. Next, blood pressure decreases when the activation of following receptors. What is that? Alpha 2 receptors. Now what we have to do? We should give antihypertensive drugs that must either inactivate these factors or activate alpha 2 receptors. Now one by one we are going to discuss. First one, alpha blockers. Alpha blockers are of two types. First one, selective alpha 1 blockers. Second one, non-selective alpha blockers. First, let us discuss selective alpha 1 blockers. They block alpha 1 receptors on smooth muscle, causing vasodilation and as a result, a decrease in blood pressure. These drugs are the first line treatment for patients with hypertension and benign prostate hyperplasia. Examples. These are end with suffix josin. Examples are adapts. We have to see capital letters with bold. A, D, P, T square, S. A, alphajosin. D, doxazosin. P, prajosin. T, terazosin. One more T, tamsulosin. S, silodosin. Next, coming to the non-selective alpha blockers. Examples are PPT, P, phenoxybenzoamine. One more P, phentolamine. T, tolozolin. Phenoxybenzoamine is used to treat hypertensive crisis in pheochromocytoma, while tolozolin and phentolamine are used to treat clonidine withdrawal and cheese reaction. So here we have to consider one thing. These drugs cause significantly higher tachycardia than selective alpha-1 blockers due to the blockade of presynaptic alpha-2 receptors. Next, coming to the beta-1 blockers. They block beta-1 receptors in the heart, causing a decrease in cardiac output and as a result, a decrease in blood pressure. These are used to treat hypertension in people with diabetes, variable angina, bronchial asthma, Raynaud syndrome, and hyperlipidemia. Examples are selective beta-1 blockers are end with suffix lol. The drugs are amibactabine. We have to see bold capital letters AMEBACBN. A. Atenolol, M. Metoprolol, E. Esmolol, B. Bisoprolol, A. Acebutolol, C. Celiprolol, B. Betoxolol, N. Nebivolol. Beta blockers can also inhibit beta-1 receptors in the kidneys and they suppress renin release, angiotensin 2 formation and secretion of aldosterone. As a result of these effects, reduction in systemic vascular resistance and reduced in blood pressure. Next, third, antihypertensive drugs. Drugs acting on renin-angiotensin aldosterone system. Three pharmaceutical targets can be utilized to lower the activity of angiotensin 2. First one, renin inhibitors. Renin is an enzyme that converts angiotensinogen to angiotensin 1. Hence, renin inhibitors target this enzyme specifically, lowering angiotensin 1 synthesis. What is that? Example, aliskiren. Next, second one, ACE inhibitors. The enzyme ACE converts angiotensin 1 to angiotensin 2. ACE inhibitors work by blocking this enzyme, which lowers the production of angiotensin 2. They can raise bradykinin levels while decreasing angiotensin 2 levels. Examples, ACE inhibitors are end with suffix pril. The drugs are Republic frequent. We have to see bold capital letters. REPBLICFQT or Ramipril, E. Enalapril, P. Perindopril, B. Benjopril, L. Lisinopril, C. Captopril, F. Fosinopril, Q. Quinapril, T. Trandolopril. Next, last one, angiotensin 2 receptor blockers. They either block the synthesis of angiotensin 2 or block the effect on angiotensin 2 type 1 receptors. This in turn leads to decreased systemic vascular resistance but without significant changes in the cardiac output. Examples: these are end with suffix sartan. What are those? Voltaic. Bold capital letters are VOLTIC. V. Valsartan. O. Olmesartan. L. Losartan. T. Telmisartan. I. Irbesartan. C. Candesartan. Next, coming to side effects, they can cause hyperkalemia because they inhibit aldosterone secretion. ACE inhibitors can produce a dry cough or in rare cases life-threatening angioedema. This is thought to be due to increased levels of bradykinin and substance P. This slide represents the mechanism of action of drugs acting on renin-angiotensin aldosterone. Here you see renin inhibitors inhibit the formation of angiotensin 1. ACE inhibitors inhibit the formation of angiotensin 2 and also they increase bradykinin levels. Angiotensin receptor blockers, they inhibit binding of angiotensin 2. Next, fourth one, calcium channel blockers. These are divided into two main subclasses. First one, dihydropyridines. They block L-type calcium channels in the vascular smooth muscle. Under normal conditions, when calcium enters the smooth muscle cell, it causes it to contract, resulting in an increased vascular resistance and as a result, an increase in blood pressure. When dihydropyridines inhibit the entry of calcium into the vascular smooth muscle cell, the contraction is inhibited. This results in a reduction of systemic vascular resistance and cardiac output and ultimately decreased blood pressure. Examples: these are end with suffix dipin. What are those? Final. Bold capital letters are F, N square, AL. F, felodipine. N, nifedipine. One more N, nitrendipine. A, amlodipine. L, lacidipine. When you come into side effects, dihydropyridines cause dizziness, headache, flushing, and peripheral edema. Next, coming to the non-dihydropyridines, these are calcium channel blockers that primarily affect the heart and have a minor effect on the blood vessels. They have a greater depressive effect on cardiac conduction and contractility, but are less potent vasodilators than dihydropyridines. It is important to note that reduced heart contractions typically result in decreased cardiac output, but non-dihydropyridines do not reduce cardiac output significantly because of the reflex tachycardia that occurs as a result of vasodilation. The drugs are verapamil and diltiazem. Next, coming to side effects, they produce severe bradycardia and aberrant cardiac conduction. Furthermore, verapamil is the least selective calcium channel blockers because it can cause constipation by blocking calcium channels in the smooth muscles lining the GIT. Next, fifth, antihypertensive drugs, diuretics. These are of different types of diuretics that are used to treat hypertension. First one, loop diuretics. They act by inhibiting reabsorption of sodium chloride in the kidneys by inhibiting sodium potassium 2 chloride co-transporter, leading to severe diuresis and reduced blood return to the heart. As a result, cardiac output falls. This in turn causes a drop in blood pressure. Mainly, these loop diuretics are used in patients with volume-based hypertension and chronic renal dysfunction. Examples: B fit. Bold capital letters are BEFT. B, bumetanide. E, ethacrylic acid. F, furosemide. T, torsemide. Next, second diuretics are thiazide diuretics. They reduce reabsorption of sodium chloride in the kidneys, but a lesser extent than loop diuretics. This causes a reduction in intravascular volume, a reduction in cardiac output, and ultimately lower the blood pressure. Examples are phobic. Bold capital letters are PHBC. P, polythiazide. H, hydrochlorothiazide. B, benzothiazide. C, chlorothiazide. Last diuretics are potassium sparing diuretics. They cause diuresis by interfering with the sodium-potassium exchange in the kidneys or by blocking the actions of aldosterone. These are often administered in combination with loop and thiazide diuretics to decrease the loss of potassium that can occur when with these drugs are used. Examples. These are of two types. ADD. Capital with bold letters are AD. A. Aldosterone antagonists. D. Direct inhibitors of sodium channels. Aldosterone antagonists are C. Bold capital letters are SE. S. Spironolactone. E. Eplerenone. Direct inhibitors of sodium channels are AT. Available time. Bold capital letters are A and T. A. Amiloride. T. Triamterene. Next, alpha 2 agonists. These are centrally acting adrenergic drugs. They act by inhibiting sympathetic activity in the brain. Examples are CM, Chief Minister, C. Clonidine, M. α-methyldopa. First, let us discuss clonidine. It stimulates presynaptic alpha 2 receptors. As a result, a negative feedback mechanism in the adrenergic neuron lowers the catecholamine synthesis, thus decreasing the blood pressure. Second one, α-methyldopa. First, it is converted to methyl norepinephrine centrally to decrease the adrenergic outflow by alpha-2 agonistic action from the central nervous system, leading to reduced total peripheral resistance and decreased systemic blood pressure. Here you see, noradrenaline is stored in the storage vesicles. Upon depolarization, the noradrenaline is released into the synaptic vesicles by exocytosis. In the synapse, this noradrenaline binds with postsynaptic receptors to produce its action. Alpha 2 agonists like clonidine and α-methyldopa bind with alpha 2 receptors, so it stops the activation of storage vesicles through negative feedback mechanism, resulting in reduction of adrenergic outflow and reduction in the BP. Next, ganglionic blockers. The drugs that block the ganglia are hexamethonium, mecamylamine, and trimethophan. As a result, postganglionic sympathetic neurons are inhibited and blood pressure is decreased. Out of three drugs, hexamethonium and trimethophan are drugs used in this group because of lesser adverse effects. Trimethophan is given as a slow IV infusion with nitroprusside for hypertensive crisis in aortic dissection. Mecamylamine is a ganglionic blocker that helps in the cessation of smoking. Here you see, these are the drugs that inhibit Nl receptors on the ganglia. Thereby, postganglionic sympathetic neurons are inhibited, thus causing decreased BP. Next, adrenergic neuron blockers. In that first one, drugs that inhibit the storage of noradrenaline. Example, reserpine. It blocks the vesicular monoamine transporter. Therefore, it inhibits the uptake of monoamines into the storage vesicles. Monoamino oxidase, which is attached to the mitochondria in the axon terminals, metabolizes unprotected monoamines, resulting in depletion of monoamines from central and peripheral neuron terminals. As a result, it is used to treat hypertension and psychosis. One important point to be considered, serotonin deficiency in the brain can lead to severe depression and suicidal thoughts. Here you see, reserpine inhibits the vesicular monoamino transporter, which is responsible for the uptake of monoamines into the storage vesicles, where it is converted to noradrenaline. The unprotected monoamines are made inactive by metabolization of MAO, resulting in depletion of noradrenaline, thus decreasing blood pressure. Next, drugs that inhibit the release of noradrenaline. Example, bretylium and guanethidine. They are transported into the sympathetic nerve and concentrated in the storage vesicles, where they displace the noradrenaline. This leads to gradual depletion of noradrenaline stores in the nerve endings. They can be used to treat hypertension because they prevent the release of noradrenaline in response to the arrival of an action potential. Here you see, guanethidine and noradrenaline displace noradrenaline in the storage vesicles. This unprotected noradrenaline is metabolized by the MAO. This leads to the gradual depletion of noradrenaline in the storage vesicles, thereby decreasing the BP. Next, last antihypertensive drugs are vasodilators. They increase nitric oxide synthesis in the endothelial cells. which lowers blood pressure and reduce cardiac output. The examples are atrioventricular block. Bold capital letters are A, V, B. A. Arteriolar, V. Venular, B. Both arteriolar and venular. First, let us discuss arteriolar. These are end with suffix dil. Examples: human. Bold capital letters are H, M, N. H. Hydralazine, M. Minoxidil, N. Nicorandil. Venular vasodilators. Examples: in IN. I. Isosorbide dinitrate, N. Nitroglycerin. Both arteriolar and venular vasodilator, sodium nitroprusside. Here, one thing to be considered: topical administration of minoxidil encourages hair growth, which is why it is more widely used to treat baldness than hypertension. I hope you like this video. If you want to purchase the book, the link is provided in the description. For more videos, you please like, share, subscribe my channel. Thank you very much.